Good morning. My name is Margo Bansen. I'm a public health nurse with Toronto Public Health. With 7 years seniority, I'm now the most experienced nurse in the harm reduction and treatment services program. We are servicing the community 365 days a year with no closures on weekends and holidays. Today, instead of working in the clinic, I'm here leaving my colleagues short-staffed to speak with you about the nursing shortage we are experiencing. Our nurses provide addiction, mental health, and medical outpatient treatment to vulnerable and often underhoused community members. We provide wound care, STI testing and treatment, vaccinations, community outreach, and case management to people who routinely fall through the cracks of our healthcare system. Referring clients elsewhere is extremely challenging when many do not have health cards, phones, or stable addresses. Many have been turned away from other services and carry trauma and stigma from past healthcare experiences. Our clinic is one of the few places they trust. We aim to provide comprehensive, continuous care so no one is left without healthcare. All this requires adequate, stable, and experienced nursing staff, which we do not have. We are currently short 7 out of 11 full-time nursing positions at my workplace. Recruitment and retention have always been a challenge. Nurses regularly pressured to work overtime, come in on days off, and cancel planned vacations or work other obligations. When no one volunteers, reverse seniority determines who must stay. This is unsustainable. Short staffing increases the risk of errors, burnout, and moral distress. Management cannot hire enough nurses to retain fast enough to keep up with the departures. Many leave for jobs that are better paid, less demanding, and more stable. A number of my colleagues work second jobs just to simply stay afloat financially. Public health nurses in our unit are at the top of the pay scale, are the lowest paid in Ontario and amongst the lowest paid in Canada. This pay inequity directly fuels our recruitment and retention crisis. We routinely lose strong nurses to neighboring healthcare units, hospitals, community agencies that offer significantly higher wages for equivalent and less complex work. Because we are so understaffed, we cannot operate at optimal level. For example, we once offered a nursing-led drop-in clinic providing essential medical and mental health care. These clinics were essential for building trust and creating opportunities for meaningful referrals. Today, we cannot staff this service. I want to praise the recommendations in today's report, but without proper staffing, meaningful recruitment, and retention strategies, pay equity for our nurses, mental health and addiction services will languish. Our clients rely on us, they trust us, they deserve stability, and nurses deserve wages that reflect the complexity and expertise of this work. Addressing wage equality is not simply a staffing issue, it's a client safety issue, a service quality issue, and is critical to public health. We need the board to acknowledge the severity of this crisis, to prioritize competitive compensation in upcoming decisions so our health unit can recruit and retain the nurses our community needs. We request the board make a motion to work alongside QP Local 79 and Toronto Public Health workers to on a report to be completed by city staff on what is needed to address these problems. That's why I'm here today alongside many public health nurses and inspectors to deliver a petition calling for a wage adjustment for health professionals signed by over 550 workers.
Okay, thank you.
Thank you.